question is, why are hospice residents not moved to skilled nursing? Memory care is skilled with carpet. You ain't lying. But there's many reasons like insurance, the fact that they've lived in the assisted living, and they don't qualify for skilled nursing. Another huge thing is with Alzheimer's and other dementias is that these patients have a variable decline. It's almost like a roller coaster, and it's a long goodbye, as many people say. So they would not necessarily do better in a skilled nursing facility. Would they have more oversight? Sure. But would it be necessarily the best thing for the patient? Maybe not. So they do well, but then comes end of life and things shift because the patient needs medications maybe around the clock, and the assisted living does not provide that. So then the family is left with either hiring private care or they have to do shifts. Hospice is able to administer medications, I believe, for 24 to 48 hours until they can get a system in place. But that's something I do wish assisted livings were more honest about, is when things start to change or when patients do need a little bit more of an elevated level of care or they need a little bit more help, how much that's going to cost and what that is going to look like in an assisted living or a memory care unit within an assisted living. Because not only is it a huge shock that they're going to need to either hire private care or they're going to need to, do shifts around the clock to administer medications, but it's a financial shock as well. Because these people are paying a buttload of money for an assisted living, and having a memory care unit within an assisted living kind of, leads them on to think that they're going to get a little bit more care because they're in a memory care unit, because these patients are not necessarily assisted living. But yeah, we can't just transfer somebody just because they're hospice to a skilled nursing facility. That would have to be something that would be indicated. The family would have to agree to it, because transferring a memory care patient is just, it's not a fun thing to do. And we try not to move them as much as possible.